We know that esophageal cancer, heartburn cancer, is related to reflux, obesity, smoking, alcohol, all the things that we know we shouldn't do, but all the things that our society seems to do. So we need to have a joined up way of getting that message across. I'm Tim Underwood. I'm Professor of Gastrointestinal Surgery at the University of Southampton. I'm lucky, fortunate and really privileged to be trustee of Heartburn Cancer UK, and I'm also Vice Chair, and I'm one of the medical advisors. So I support all the medical context for the work that Heartburn Cancer UK does, the vital work that it does across the country. The real challenge for early diagnosis in esophageal cancer is that the symptoms are very, very common and they overlap with just standard heartburn. So it's really difficult to differentiate people who definitely have cancer from those that don't. Now, one of the things that Heartburn Cancer UK is funding that will have a fundamental impact on this is the cytosponge that's been developed by my co-trustee and good friend, Professor Rebecca Fitzgerald from Cambridge. This is a sponge on a string that's swallowed down. It can be done in primary care, in the GP surgery. The sponge is pulled back up. It takes cells from the lining of the esophagus and they can be looked at under the microscope. And Heartburn Cancer UK is funding lots of research into that area and also promoting early awareness and early diagnosis of the devastating cancer that I unfortunately have to operate on. All surgeons in the United Kingdom are part of one of the Royal Colleges, and there are a number. I'm really lucky to be part of the Royal College of Surgeons of England. I'm one of their fellows and one of their members. And I have a role within the Royal College, which is the surgical specialty lead for esophageal cancer. And my surgical specialty lead role is linked between the Royal College of Surgeons of England and ORGIS. ORGIS stands for the Association of Upper Gastrointestinal Surgery of Great Britain and Ireland. It is an association that brings together surgeons, specialist nurses, dietitians, support workers, everyone involved with dealing with patients who have disorders of the upper gastrointestinal tract. My Royal College role is inextricably linked to Heartburn Cancer UK, with a host of projects that have been funded by Heartburn Cancer UK and administered by the Royal College. They involve lots of surgeons around the country coming together to bring their data together, to bring their skills together. I'm also involved with training the next generation of surgeons, making sure that esophageal cancer is right at the top of the agenda. We've been working recently with the National Esophagogastric Cancer Audit. That's a record of every cancer operation for the esophageal cancer type done in the UK from 2012 until present day. And we're using that rich data source to understand how to personalise treatments better for cancer of the esophagus. Not only is that good for patients, it's good because we can withdraw treatments that aren't going to work. It's good financially because you don't give inappropriate treatments to the wrong patients. And it's good infrastructure-wise because the healthcare system is better resourced by targeting the right patients for the right treatments, for the right ailments at the right time. So in my ideal world, and this might seem odd as a surgeon, I'd like to stop operating on cancer of the esophagus. And I'd like to stop operating on it because I wouldn't be seeing it at an advanced stage. If we can diagnose people earlier in their cancer journey, we can, one, treat them earlier and maybe prevent cancer happening in the first place, but also use things like endoscopic treatments, which are camera-based treatments that don't involve the massive surgery that I do. Like all charities, Heartburn Cancer UK is driven by fundraising, and I've been part of doing that. I ride my bike. I think everyone who knows me knows I ride my bike, and I ride my bike quite a lot. So I thought to myself, how can we put that to good use? And I've done a couple of trips across the Alps where we've raised money for Heartburn Cancer UK, and we've got something coming this summer in the Welsh Mountains. So look out for that. There'll be some ridiculous cycling going on, and hopefully people can contribute to a good cause.